Thank you, Ariana, and appreciate the warm welcome, and for Leanne for inviting me to come and do a talk today. I'm a clinical assistant professor in the School of Environmental and Community Health. I joined the faculty in January after 20 years of practical public health experience in state and local health districts, departments. I was the division director for population health data at the Virginia Department of Health. I worked as a population health manager out in Lynchburg, Virginia, and I've worked in global health as a director of monitoring and evaluation, and in national organizations like the National Institutes of Health and American Cancer Society. So I've got a lot of great experience under my belt, and I'm super excited to now be investing my time and my career into the next generation of public health professionals and health sciences professionals and clinical professionals across the board. So health and well-being are definitely shaped by the conditions of our environments and the boundaries of our policies and our practices and the social and cultural contexts in which define us in our populations. So I hope you had a chance to read the Brookings Institution article by Bateman and Ross, sort of as a precursor to our conversation. And I'm going to share a lot of data with you today, and I don't want you to tune out because I'm just going to hit the highlights. We're not going to discuss each slide in depth, but it's really just to demonstrate and illustrate the differences among men and women and the economic differences and implications that this has on our population's health. So where are we today? In 9 months, January 21st was our first case of COVID. Here we are, November 9th this week. We crossed over the 10 million case threshold. We got a huge warning in June by Dr. Fauci, our beloved Dr. Fauci, that we could be hitting 100,000 cases a day. I believe yesterday was the highest date on record since the start of the pandemic, with over 145,000 cases reported. It could very easily be the beginning of December before we start seeing 200,000 cases a day. So COVID-19 is a crisis in resources and disproportionate impact. And we know that this is significantly affecting American households in multiple dimensions and ways. And so to respond to a public health crisis like this, we have to be cognizant of so many different sectors, so many different disciplines, and really what is the intersection of all of those together so that we can have the healthiest population and really survive this pandemic. So there's many considerations as we need to, like I said, as we need to move forward if we want to suppress this disease. So since January 21st, this helps to put it a little bit into perspective. In 98 days from the first case, we hit 1 million cases. 44 days later, on June 11th, we hit 2 million cases. July 8th, we hit 3 million cases. July 23rd, we hit 4 million cases. August 9th, we hit 5 million cases. August 31st, we hit 6 million cases. September 25th, we hit 7 million cases. October 16th, we hit 8 million cases. October 30th, we hit 9 million cases, and just 10 days later on November 9th, we hit 10 million cases. So this is truly a surging pandemic in America. So for the purposes of this, I use data from the USC Center for Economic and Social Research. They operate a Understanding America study, and it's a tracking survey that's done every week with certain panels of people, and it is representative of the US population. And it gives us really good understanding of what is happening and what people are thinking and how they're behaving, and where we might, as health professionals, be able to adapt or modify what we're doing to address the problems of COVID-19. It is a valuable resource to help us understand specifically gender inequalities as well. And it really helps to put the pandemic in a frame where we can begin to propose policies and practices and systemic changes that might need to be made that will help women in the long run. So please feel free, like I said, to put questions in the chat box, and we'll pause along the way. Before we get started though, I would love to see what you think. So I'm gonna launch a poll, maybe. And go ahead, and there's 8 questions. Go ahead and make your guesses. All right, let's see what we got. All right, so just so we can keep tabs on this as we move along. Looks like the majority said 8% of Americans have been diagnosed with COVID-19. Who is avoiding bars but gathering places but not visiting people, or not, can't even read my own questions, but visiting people and hosting visitors in the home. Who is doing better, with coping through the pandemic? We've got men. What percent of US women went without eating a whole day in the past 7 days? We've got 2.4% and 3.4% highlighted there. Who received more average unemployment insurance payments? Men. Who missed more payments? Missed, delayed, or sent in less payment? Women. What percentage of women needed to take sick leave? We've got 44%. And with gender inequalities that are exacerbated by COVID-19, we've got picks for all with 100% for jobs and employment. So keep all that in mind as we move along. All right, so testing and diagnosis. So generally speaking, 3% of the US population has been confirmed with having COVID-19. That is enough people to fill the Rose Bowl Stadium in California 110 times. And of that, 2.5 stadiums worth of people have died because of COVID so far. So just over 1/3 of men and women have been tested for COVID-19, and women have a slight lead there, but more women than men have been diagnosed with COVID-19 in the US. Women perceive their chance of becoming infected and dying of COVID-19 to be higher than men. This means that 1 in 4 men and 1 in 5 women believe they are susceptible to getting COVID-19, even though less think they will die from it. So this is really important. If you're familiar with the health belief model, in order for people to have self-efficacy, to take the actions that they need to prevent disease, they have to perceive susceptibility and severity. Like, can I get this, number one, and then how severe will it be? Along with acknowledging the benefits and the capacity to take action or personal responsibility, whatever you want to call it. And so this tells us that health belief about COVID-19 is not strong enough, even after 9 months and 10 million plus cases. So slightly higher percentages, more women believe their family and friends have coronavirus than men, which is also part of that health belief, severity, and susceptibility idea. But let's look at the actuals. So confirmed cases, more women have contracted COVID-19 than men. But disease outcomes for men have been less favorable, especially with death. So knowing how people think and behave about this coronavirus is really important if we want to figure out how to mitigate it, control it, suppress it, and stop it from spreading altogether. So let's find out what kind of social and non-social activities are happening here. So equally, both men and women are grocery shopping at about 82%. More men are going to bars and clubs and other gathering places at almost 15%. And just over a quarter of men are staying home. So these are you can see the trend lines here for men related to these activities, and approximate how many people are participating in these social and non-social activities. So for women, they are visiting their friends more and their neighbors and their relatives and hosting more people in their homes than men are. They're also attending gatherings of more than 10 people and visiting hospitals or healthcare facilities more than men. Now that could be because of occupation, that could be by the nature of being a woman and or being a mother and having to take care of family members or older relatives or parents. And so that may be more related to employment than actual social interactions. So a comparison of some other activities here. Men are sharing items as about the same as women. Slight increase among men in close contacts with those in their homes and non-residents. Men are getting outside more than women are, which has a strong connection to protective health behaviors. So overall, the trend lines for both men and women for social and non-social activities indicate some slight differences, but within the same range of behavior. And so I think the biggest takeaway from all of this is that we can be doing better with spreading messages about non-essential close contacts. So close contacts outside of the family unit or the immediate relationships and connections within the home. All right, so when disease prevention is put on the backs of individual responsibilities, we're going to experience a lot of personal failures. COVID-19 is a community spread disease and individuals alone cannot stop it. And this is why states and localities implement policies and mandates at the population level. So slightly more women are wearing masks and or face coverings and washing their hands more than men. So 90%, 94%, that's pretty high and pretty comforting from a public health perspective. Men, just right under there, 88%, 89%, doing a good job. Now, this is what people in the survey said they do. We're going to look at some other data that talk about behavioral intentions and how that aligns or misaligns with what people are reporting that they do. So despite higher levels of having close contacts for social interactions or activities, women respondents report avoiding high-risk contacts in public spaces and places, gatherings, and crowds. From this, we can infer that behavior and intentions, like I said, can be misaligned, meaning what I did versus what I intend to do can be very different observations. And this doesn't mean that women are bad or confused, because we're not, but the survey doesn't tell us the reasons why these differences exist, just that they do. So again, women in how they feel like they're protecting themselves, the measures and steps that they're taking, they're praying more, they're avoiding restaurants more, and they're working and studying at home more than men are. So where it counts, men's beliefs in measures that are effective for keeping safe from the coronavirus. There's high belief among men for most categories. So this is encouraging that there are beliefs that these are effective ways of personal responsibility, individual responsibility for managing prevention of COVID-19. But in comparison of the percentages for effective measures for keeping safe among women were higher than they were for men in all categories. So women tend to have stronger beliefs in what is effective and the right actions that they need to be taking to mitigate contracting COVID-19. So thinking about what is safe to avoid exposure to COVID-19 is a good indicator that behavior will follow. Women have slightly lower beliefs about what is safe to avoid exposure than men in the areas of grocery shopping, gathering of 100 more people, and visiting a hospital. Women have slightly lower beliefs about the safety for avoiding exposure than men in visiting restaurants, eating takeout, visiting relatives or friends, and handling delivered packages. Still, it's really important to point out that over 2/3 of men and women think that eating takeout is safe, while 1/3 or less believe visiting a restaurant is safe. We know that indoor restaurants is one of the riskiest places to contract coronavirus. Both men and women believe close contact in the home is safe. This assumes that there is a bubble of protection around the family or around those living in the home, and that no one else is coming in or out. This also assumes that if someone in the home gets coronavirus, the family will be considered exposed and have to quarantine, while the infected member isolates completely. So when asked about getting a virus vaccine, if once it's available, more men than women indicate agreement. So interest in the vaccine has definitely waned since April, if you see the trend line there, dropping from 84% to 67% in men and 80% to 56% in women. Some speculation on the differences here relate to there being more women we know who tend to be anti-vaccination. All right, so who is doing better at coping through the pandemic? Mental health has been somewhat discussed as part of the impact of COVID-19 on our lives, but often is understated or stigmatized as an individual problem. And I just would like to give us a moment, a collective moment, to take a few deep breaths and acknowledge that we are all impacted by this pandemic. And it's not a matter of having it worse than someone else, but it's really about meditating on the notion that this time in our lives is really hard and it's okay to not be okay. And if you're struggling, I want you to reach out and say so. And Leanne and I, we can connect you to some good resources and some good people. So send us a private chat message or an email if you feel like you need it. Just know there's a community that cares about you and wants you to feel loved and appreciated. So men find coping strategies through the pandemic using alcohol, exercise, relaxation, and social connection. Women cope with meditation, relaxation, and social connection. Now, women are not exercising or drinking alcohol as much as men, or the number of days, but are using cannabis and other recreational drugs more than men. We know that for women, especially those who are mothers, stress is associated with lower quality of life, which then perpetuates the cycle of psychological stress. Limbers, McCollum, and Greenwood published that the interaction between stress and moderate physical activity were associated with improved social relationships and overall quality of life. So maybe we can encourage women to try to get outside more, to try to find ways to take a walk or ride their bike, or something that gives them a little bit of a heart boost and a way to get some physical activity in during their week. Depression overwhelmingly affects more women than men. 1 in 3 women are experiencing distress right now, and that is an incredible amount of people, whereas almost 1 in 5 men do. Women are not psychologically well right now, and the exacerbated trauma of this time is going to have long-term impact. So as we consider our roles within health sciences and public health and population health improvement, we are going to have to be very cognizant of the connection between mind and body and spirit. So moving kind of from the psychological and physical elements of the impacts of COVID-19, I'm going to switch gears now to the economic impacts. So those that are currently employed in the workforce right now, about 59% of men and 53% of women, not too different. You can see by the trend line that men are typically have higher percentage of employment than women. Over 4 times more women than men were dropped out of the labor force in September of this year. And that means for every 3 women that dropped out of the workforce, only 1 woman replaced those 3 women. So we're seeing huge losses in jobs, both by their own decision as well as being furloughed or fired, positions eliminated among women in the workforce. And so, as would be expected, women are slightly more concerned about losing their jobs. This supports the idea that many companies are struggling to meet their bottom lines. business-wise, and therefore don't always have the capacity to consider a woman's need or for, say, flexibility in their schedule or improved wages or, the competing work, home, or family life. So across the whole spectrum of this pandemic, you can see that women were at higher percentages than men overall for losing their job or perceiving they will lose their job. Women are more concerned than men about running out of money in the next 3 months. When it comes to food insecurity, this is actually an issue I research and I have several projects on, and twice the percentage of women than men worry about running out of food. And so if a woman reports that she's worried about running out of food, this typically means she's a mother and there are other mouths to feed. 8% of women are eating less than they should be, and 3.44% of women went without eating for one whole day. That's 5.7 million women in the last 7 days who went a day without eating in America in 2020. And so as health practitioners, public health professionals, how do we expect individuals to be healthy when these are the conditions of their existence? We can give them all the right medical advice in the world, but it will not mean a thing if we do not systematically change the way we give women the chance for equity. So let's see how this looks like in the social safety net. So more women received housing assistance and economic stimulus funds. That's good, right? But it's also indicative of that greater problem where women have to benefit more from these programs because of the inequities that and the conditions of their environment. So there was a question that was posed in the Google forum about, which was, why do we think government's main option is to resort to temporary legislation? Does legislation get rushed in the process, inadequately helping women? So the stimulus package funds that were released earlier this year did help women and families for sure. But the situation right now is worse than it was then. And as we approach the holidays and towards the end of the year, when it gets a little bit colder, we use a little bit more utilities. It doesn't look like Congress is going to take any other action to make anything permanent or to do anything temporary to help the American people. But it's when we combine these temporary legislation for economic stimulus with other interventions, public health interventions that are deliberately intended to control and mitigate and suppress coronavirus spread, we get a compounding effect, right? So everybody can do better. And the government typically thinks in terms of like one-off solutions, like if we just do this one thing that, it's gonna be okay, we're gonna put the Band-Aid on the wound for just a little bit until it starts weeping and getting infected again, right? So we have to think in terms of whole and integrated and multi-level strategy. So with unemployment, we know that it hit an annual high in May with 12.2% of men and almost 15% of women unemployed. In September, and these percentages might sound low, like 15% of women in America were unemployed. That's millions and millions and millions of people. That's not a small group of people. And when you have that large unemployed, the economic impact, the lack of investment in community business is why we're seeing businesses close up, right? So it's that cyclical effect. In September, though, rates showed that it was improving. 7.7% of men and 8% of women were unemployed. Payment amounts illustrate, again, the disparity of earning potential and marginalization, as noted here by the $230 difference in average payment between men and women. All right, so student loans. Oh, those student loans, pesky loans. We can see that women experience more missed or delayed, or they sent in less money on their student loan payments by men by almost 10% this year. It's kind of a noisy line there on the trend lines between men and women, but the black line being women, you can see overwhelmingly have struggled to pay their student loans. Mortgages, women experienced more missed or delayed or sent in less mortgage payments than men by almost double since the pandemic started. And with renting, women who are renters experienced more missed or delayed or sent in less rent payments than men by 3.6%. So this trend line has shown a decrease since April due to federal and state deferral and forgiveness plans and policies. And those were put into action to prevent evictions, so to keep people in their homes as long as possible. So men have more sick leave on average than women overall, but experience a wider gap among men with those who have 0 days or those with 14 plus days of sick leave. Only a quarter of women, 25%, have 2 weeks worth of sick leave at their disposal. This is alarming. If there would be any emergency or if they were to get COVID-19, easily 14 days, their sick leave would be exhausted and they would not have any left, and therefore could be subject to not being paid. This next slide really bugs me, but a significant difference between men and women is evidence for needing permission from their employer to use the sick days. Since the return to work phases have been enacted in many states, although we're starting to see some of them change and likely to the end of the year, more women than men have been told to work from home. And from those reporting working from home, there are slightly more women who are doing so. So lots of data just thrown out at you. And all kind of just are meant to illustrate and demonstrate the inequities that have been exacerbated by COVID-19. And certainly the unprecedented closures of schools and business and work, the social physical distancing measures, other mandates, mask wearing, stay-at-home orders, all to contain this pandemic have drastically magnified gender differences. And we know from previous national emergencies of all kinds that this can have serious long-term negative implications, specifically for the female labor force and female participation in the workforce, the gender wage gap, and household incomes across the board. So in public health, we really focus on social justice as a primary means of improving length and quality of life. There are clear disparities. So just to recap from the data shared, women face more time working from home, less sick leave availability, more student loans, mortgages, and renters missed, delayed, or paid less unemployment monthly support, more government assistance for housing, more food insecurity. They're afraid they're going to run out of food, or they ate less, or they even went a whole day without eating. Higher chance of running out of money in the next 3 months, higher chance of losing their jobs, more stress, depression, and anxiety, less positive coping opportunities like meditation, exercise, and relaxation, more willing to take protective measures, but less trusting of what's safe and effective to avoiding exposure. So what do we do about it? This is a lot, right? Well, this is not new. Probably not the message you wanted to hear, but approximately 60% of the jobs eliminated in the first wave in the spring of the pandemic-induced layoffs were held by women. 60% of the jobs were held by women. Single moms especially have been particularly hard hit by this pandemic and losing jobs at higher rates than other families with children, especially because women's occupations are primarily in retail and hospitality industry, food service, childcare, education, arts. And so working women are taking on this burden of trying to maintain their own survival and livelihood, their family, their children, and the disproportionate impact asking women to absorb these shocks that are kind of happening throughout the population, bearing the brunt of this public health emergency. We as women cannot single-handedly manage this. And so, because women are vulnerable to these economic impacts, we know the gendered nature of our work and the lack of systemic process, the social barriers. Like, we have to start elevating the narrative on this from every discipline in the workforce. Female jobs are clustered in certain occupations. Female jobs are more at risk because of that, and because of their roles within the home. Those traditional mindsets about the role of women and how they experience the consequences of a crisis are different than men. And these, again, effects are going to be around for a long time. The female labor force participation rate actually dipped to 54.7%, just under 55% in April this year, for the first time since February 1986. I was 9 years old. And so when that last, it was 54.8%. So 1986, women have been burgeoning in the workforce and becoming more educated and getting degrees and promoting advancement and mobilization. And in this year alone, it took us back all the way to the rate we were at in 1986. So during the COVID-19 pandemic, they're saying that women are being exposed to this triple whammy, right? So frontline workers are at risk for contracting COVID-19. Workers that are in those specific occupations and industries are experiencing greater economic distress. And then caregivers, women as caregivers are shouldering the increased demand for domestic work, as well as having their children to school at home or not having options for daycare. So the fact that we're observing these significant gender differences or exacerbated gender differences, relates to less working hours for women, especially for college educated respondents in this survey. There's a positive association between childcare responsibilities and increased transitions out of employment. So just on a personal note, I'm a mom, I have 5 children. Fortunately, 4 of them are in high school and they're pretty self-sufficient. I don't have to spend a lot of time overseeing them, but I do have a 6-year-old who's in 1st grade, and he just takes up a lot of my time during the day, and it is literally juggling balls. So while this issue is a research topic for me, it is also very personal, and I'm learning a lot myself too. So the Economic Policy Institute has a women's economic agenda, and they have outlined 12 policies to support women. And so each of these 12 priorities, not as one individual thing, but in a collection, in a coordinated approach, will help to get women back on track. And we can start these things now. We can still be talking about these things because health is wealth, right? When you're able to take care of your needs, you don't have to be dependent on someone or something else for that. And we want, a higher percentage of people in the population who have employment, who have income, who are able to, take care of their health and well-being. So raising the federal minimum wage, even to just $12, would boost wages for 1/4 of the workforce. And that's 35 million working people, 56% of whom are women. Raising and eventually eliminating the sub-minimum wage, which is currently $2.13. Many of you may have worked in the hospitality restaurant industry before. For workers who earn tips, will help to boost wages and stabilize your income for, again, millions of service workers, large percentage of women. Women in unions are more likely to be paid higher wages and have access to better benefits. There are significant wage gaps, obviously, that still exist. The median women's working earning is 83 cents to a man's dollar. And this disparity, even if it were to be raised 7 cents, so even if we were earning 90 cents to a man's dollar, would be billions of dollars of investment in women in the workforce and have a residual and compounding effect on the economy. Only 12% of private sector employees have access to paid family leave. 12%. That is so low. And without obviously having paid family leave policies, women, again, we're in this pandemic, we're struggling to balance the demands of work and family. Over 1/3, so almost 40% of workers have no paid sick leave. Again, many of them women. So these other policies are just, again, in concert together as a collective, if we were to implement them, would have a significant benefit on our economy. Couple other notes here. Monthly childcare cost for a 2-child family exceeds the cost of rent in 500 out of 618 metropolitan and rural areas across America. Childcare for 2 kids exceeds the rent. And so ensuring access to affordable childcare lets parents have more money and able to balance that work-family demand and invest back into the economy for the things they enjoy. Other aspects there are protecting and expanding Social Security. In terms of undocumented workers, are majority women. Giving them a path to citizenship also is supportive. Labor standards and prioritizing wage growth. Being able to move stagnant wages based on economy growth. So over the past 35 years, for example, wages have not grown, whereas productivity has grown 65%. So there's a misalignment in wages and production. And so better wage growth and planning that out is going to give groups more competitiveness in the labor market, and they retain their talent, they retain their workers. So one of the questions posed in the Google forum was, how much would creating equal pay in the US change the outcomes that COVID-19 has on women in the workforce? Would it make a big difference on its own? So yes, even like I said, even if we were to increase 7 cents on a man's dollar to 90 cents, that 7-cent increase would be billions in social equity. And investing in women makes a huge difference in our economy. So getting to my final slides here. So in public health, we take the upstream approach by moving beyond the immediate social needs, so what an individual person might be struggling with, and we focus on improving community conditions using law and policy and regulation to develop and implement those improvements. So everyone has what they need to be healthy. That is the awakening COVID-19 has brought to us, and elevated health equity to the forefront. This is specifically, I think, a great cause for optimism and political mobilization. So three main ideas that public health is supporting through social justice right now. Paid leave. The US, one of the most developed countries in the world, has no paid parental leave for parents to take during difficult times. Now, some states have implemented certain law and policy to support paid leave for 12 weeks after the birth of a child or adoption of a child, things along those lines. But for any difficulty, we have no universal paid parental leave policy in America. We also have no universal child care system on which parents can rely. We have no federal minimum standard for vacation or sick days, unlike every other Western industrial nation. So we know robust paid leave policies would allow women to hold on to their jobs while parenting their children through a pandemic. It is one of the smartest, easiest, fastest solutions that even at a company level or corporate level, looking to provide relief and to maximize performance can do. And really that first step is offering flexible hours, flexible schedules. This means giving the autonomy to the woman, to the employee, to determine when they are going to complete their work. The second thing is income and wage equity. For so many women, they see how little support they have. They're in a never-ending battle to figure out how to put food on the table, to keep a roof on their heads, find somebody to watch their kids so their kids aren't home alone while they have to go to work. And sadly, like many things, when it starts to affect advantaged people, privileged people who have not ever experienced these difficulties before, something finally gets done about it. This is similar to the war on drugs and the opioid epidemic. One was policed into submission and the other was allocated resources to management. But I digress. That's another topic for another day. Over the last several decades, though, millions of women have joined the workforce and made huge gains in their educational attainment, which actually exceeds that of men. Yet women are still paid less than men. The gender wage disparities that are present across the wage distribution and within educational cohorts, occupation and sectors is at a grave degree. It's really bad. So closing that wage gap is unequivocally essential to helping women achieve economic security. And the last policy issue is universal childcare and early learning. We know we have to redesign childcare options that are affordable, high quality, and available, and that really has to be the goal. I'm privileged to sit on the Smart Beginnings of the Virginia Peninsula work group, and we're talking a lot about this right now because of childcare centers having to close, or those that have been open to essential workers. How do we start meeting the need of this new family dynamic in this pandemic? And it's been really encouraging because the innovation is starting to come forth. We know that American mothers spend nearly twice as much time on housework and caregiving as their husbands or their partners, and realizing that it shouldn't only be up to them to have to manage all of that work, those work and family commitments. But they are shouldering the burden of childcare and homeschooling during daytime hours, and there's just simply not enough time in the day to get it all done. Just an interesting fact, during World War II, as the government pulled women out of their homes and into the factories for ammunition development and other things that were needed during the war, there was a huge question then about, well, with women at work, what do we do with the kids? And they rapidly conceived and authorized funding for universal childcare. So we've done this before. This isn't a new concept, right? And it was all because of the war effort, but the program put federally subsidized childcare centers in every state, and 6 million women were able to participate in the labor force, in the workforce. So maybe one day, childcare services will become part of the infrastructure again. But until that time, companies can start looking at ways to retain their talent by offering childcare benefits to their employees, factoring in that childcare as a benefit for that, in the package for their employee, is going to pay off in the long run by being able to retain women in the workforce. So, another solution, something kind of low on the list of strategies, is just simply, if a woman has left the workforce and is trying to come back, as a hiring manager, try to prioritize the hiring of women, make it easy for them to transition back into the workforce if they've had to be home during this year. There are ways still to elevate the role of supporting women and looking at it from the social implications of health. So the pandemic will likely exacerbate inequalities between women and men in occupational attainment, lifetime earnings, and economic independence. But as cases continue to climb, the government must weigh the consequences of these gender differences of COVID-19 in order to deliberately, intentionally support women, especially mothers, and their employment needs. So I hope you learned something today, and I appreciate the questions. I want to check the chat box to see what else might have come in. So this work is definitely ongoing. The University of Southern California, the Dorn Life Economic and Social Understanding America survey, they're publishing data weekly, which is really exciting. So we can continue to watch how this ebbs and flows over those social and economic factors and the implications on health and well-being.
So thank you so much, Dr. Hoglund. That was a lot of information, a lot of which I'm living through right now, as it sounds like you are too, because I have 2 kids, a 9-year-old and a 4-year-old, and I pay $876 a month for my 4-year-old to go to daycare, but only until 3:30 in the afternoon every day because of for COVID. So I agree, it's definitely an issue, and I can't imagine for folks who can't afford to pay that ridiculous amount, you know what I mean, to take care of their kids. You mentioned so much. Some of our students are they're all taking sociology, some are taking history. So I'm glad you brought up the war, because those who are in my class, we just finished talking about that. But I'm curious, you know, the Fair Labor Standards Act in 1938, it took the Depression, right, to make that happen. So how do you think that extends to now? How do we see change happening in these areas when we have a Congress that seems to be unable to compromise? Like, and then I guess the last thing that popped into my brain listening to you, for all of the ladies who are here, they all want to be health professionals. So as women going into fields of medicine and wanting to be primarily nurses, but also dental hygienists and public health professionals, and maybe hoping to go on to medical school, like what are the implications, do you think, for those fields that do have, you know, heavy reliance on women to work in those fields?
Yeah, absolutely. So to your first question, you know, the CARES Act, Coronavirus Aid Relief, Economic Security Act, was temporary, right? So one way to legitimize this is to make it permanent, and to see that we are going to need economic stimulus for a long time as the residuals of all these things fall out. And then secondly, as women, you know, if I always think about, like, what would I have wanted to know when I was 18, 19, 20, whatever. And so I always go back to, you know, your benefits, like when you get offered a job, know what those benefits are, and always be willing to negotiate your salary or your wage. You can always push back and say, you know what, I think I'm worth 50 cents more, or I'm worth $1 more, or I'm worth $20,000 more, or whatever it might be, right? So don't be afraid to negotiate. Don't be afraid to say that you are worth that man's dollar. And no offense to any men that are on here. But, you know, that's part of advocating, right, for women and raising the bar, because then the woman behind you who comes in, and the woman behind her, and the woman behind her, you've set a precedent now. You've set the bar higher for her and them than it would have been. So just realize that you have power in that. And, you know, as you think also, you know, if you want to start a family one day, you know, think about how you're going to pay for these things. Ask your employers to invest in you if they want to retain you, you know, that these are investments that will keep you on board, that will keep you committed and loyal to working at that organization or corporation. That's a lot to unpack. I shared a ton of data.
All righty. Well, thank you so much, Dr. Hoglund. Really appreciate it. I know I learned a lot, at least, if nothing else.
Can we throw that poll back up there just real quick to see?
Yeah.
All right, so good job. It was 3% so far have been diagnosed with COVID-19. Question 2, correct. Women are avoiding bars, but visiting with people, hosting visitors in their home. Men are doing better coping through the pandemic. Unemployment insurance, men are receiving more there. I skipped a question. 3.4% of women haven't eaten or went without eating for a whole day. 6, the women are disproportionately affected by student loans, mortgages, and rent payments. The percentage of women needed to ask to take sick leave is actually 57%. So close, but 57% of women have to ask permission to take sick leave. And then all of the above, actually, for the gender inequities that were exacerbated by COVID-19. So you showed improvement. Good job. Excellent, excellent. All right. Well, thank you, Leanne, and everybody for listening along today. If you're interested in, talking more, learning more, feel free to email me, or I can send you the link to the data set if you're interested in exploring more.